The Conservative government in Ottawa is committed to a public and publicly administrated healthcare system. We're also committed to the Canada Health Act. We've increased funding in the last 5 years of our government by 6% each year for more than a 30% improvement. Healthcare is run by the provincial government, but we're proud of working with them to coordinate certain national strategies, such as working with the National Cancer Society or the Canadian Cancer Society, and also on a new mental health commission. It's important that we keep working with the provinces to provide stable funding that they can use to provide health care to Canadians.
The Liberal Party has already made explicit two platforms. One, to meet with the provincial premiers as soon as possible after the election to discuss the creation of a new healthcare accord. And two, to ensure that this new health accord will have an increase of 6% annually in healthcare funding transfers. As well, in our policy book, we have brought in a new brain strategy to discuss neurological diseases study. We are going to bring in a new pharmacare program to help those who cannot afford prescription drugs. And we want to look into a health strategy through food strategy, by which is meant in the long run we reduce sodium in foods, we increase health labeling, and we ensure that obesity does not become a Canadian pandemic.
The most important thing that we can do for healthcare is to make sure that we maintain the promise of universal healthcare. As most Canadians are aware, we actually have the Canada Health Act, and it's the responsibility of the Federal Act to enforce that bill. Where some jurisdictions vary from that and they start providing a leg up, front of the line to some people simply because they can pay hundreds of thousands of dollars for specialized services. What we're saying is, instead, let's invest in and let's cooperate with the provinces and territories in delivering more cost-effective health care. The highest rising cost in health care is the cost of pharmaceuticals. The provinces and territories have been trying to cooperate and bring down those costs by bulk buying of generic drugs. We're saying, where's the federal government? Come to the table, provide the leadership, but additionally, bring support behind the innovations. Alberta has shown incredible innovation and piloting of ways to make the delivery of health care more affordable and more timely. So we're saying the federal government can provide leadership and provide direction to the country and ensure everybody has affordable, universal health care.
Canada's healthcare system has to be extended beyond the hospital into the everyday lives of Canadians. We need programs to educate Canadians on the benefits and the necessities of eating properly, of getting regular exercise, and maintaining a healthy lifestyle. Of course, there are sicknesses and injuries that can't be prevented, and those need to be dealt with in an efficient and a quick, efficient, and effective manner. So, in order for that to happen, Canada needs to train more healthcare professionals that are distributed to reflect the needs of both urban and rural populations. As well, we need to reduce the cost of expensive pharmaceuticals so that all Canadians can enjoy a healthy lifestyle, an affordable healthy lifestyle.